Hi, thanks for joining me today. I'm Brandon Meline, the Director of Maternal and Child Health from the Champaign-Urbana Public Health District. Here at the University of Illinois in Champaign-Urbana, I hold a position, adjunct faculty position here at the university as well, and I'm going to be talking to you about the WIC program. So the WIC program has been around for about 40 years. It is not an entitlement program. That is, people have to have a risk criteria and meet certain eligibility criteria to be on the program. It's not like a food stamps or a cash assistance program where it's an income-based requirement. So WIC has been around and it was created to really help with nutrient deficiencies back in the 70s. Having a supplemental food program for a specific population is a little bit unique as well. So we're serving moms that are pregnant, postpartum or breastfeeding, and babies and children up to age 5, from birth to 5. So I'll talk to you a little bit about that program and how it works and the benefits of the program and why it has sustained funding for 40 years. The mission of the Public Health District, where most of the WIC programs in the state and the country are housed, is to improve the health, safety, and well-being of the community through prevention, education, collaboration, and regulation. WIC covers a lot of those tenets of our mission, so we'll talk about that. The mission of WIC is to safeguard the health of low-income women, infants, and children up to age 5 who are at risk either medically or nutritionally. So we'll talk about that as well. So WIC is really intended to secure the health of pregnant women and to really reduce the risks of morbidity and mortality in infants. The reason that WIC has been funded for as long as it is, just like most entitlement programs or discretionary programs, you have to show that there is actually a benefit and a cost savings to investing in a program like this. So WIC has been around because it does reduce expensive morbidity and mortality costs from the Medicaid population. So less babies born prematurely, less low birth weight babies, less babies that spend time in the NICU. There's some research that has shown that WIC does work. Back in 1990, there was a research study that showed that women who do participate in the program have less of those adverse birth outcomes than women who do not participate in the program. You see anywhere from $1 to about $3.50 saving for every dollar put into the WIC program, so it is a sustainable model in saving taxpayer dollars on Medicaid costs. So just to give you a little bit of background about how the program works also, the eligibility standards are not the lowest of income standards, so you must meet 185% of the federal poverty level standards to be eligible for the income standards. You also have to have residency in the county where you're seeking services. So just to give you an example of that, a family of 4 can have an income up to about $44,000 and still be eligible for the WIC program. So again, moms that may not be able to work during pregnancy, we are able to take 30 days worth of income. So if they go on disability, even if they didn't qualify, if they were working full-time during a pregnancy, they may qualify for that assistance because again, the goal is to have a healthy pregnancy. Infants are certified if their mom is on the program during pregnancy, so they immediately become eligible. And then again, we can follow those infants all the way up to age 5. So WIC is a little bit of an early intervention program in that regard, meaning we provide food and education and some preventative health screenings throughout that time as well. So we'll talk a little bit about what foods WIC offers, how someone enrolls, the process and education that folks receive. So you have to have some sort of nutrition risk, as I mentioned before, to be on the WIC program, and that's assessed by actual nutritionists. I myself am a registered dietitian. I no longer see clients on a day-to-day basis. I'm running the division that houses the program, but we have about 7 nutritionists, some registered dietitians, some non-registered 4-year degree nutritionists that provide the training here at our local health department. It's a little bit unique to have actual nutrition trained nutritionists in the program because public health has an exemption for nurses to be able to work in the WIC program and dispense nutrition advice without a license. So it's a Department of Regs exemption as far as scope of practice that nurses are allowed to do that. So most health departments, especially smaller rural ones, will have a nurse doing WIC as well as the other case management programs. Talk a little bit about the timeline of visits and how the program works. Again, if a pregnant woman enrolls in the program, she's initially screened and provided an assessment. All of our assessments are now, as I mentioned, participant-centered, trying to meet the client where they're at. For those of you that are familiar with the trans-theoretical model, stages of change, we are doing open-ended questions, motivational interviewing, to try to get the client to volunteer information. When I started just about 15 years ago, we were preaching by the food guide pyramid. WIC didn't provide fruits and vegetables at that time, but we would preach, why aren't you eating 5 fruits and vegetables? Why aren't you eating 3 servings of dairy? Those types of things. We're now leaving it up to the client to talk to us about what they would like to change. We have learned over the years that preaching to our population doesn't really result in behavior change. You got to meet them where they're at and set small, realistic goals. For example, somebody may have a horrible diet, but they might be willing to try to include 2 servings of low-fat milk in their day. That's a successful education and goal setting. They may not meet the food standards that we would like them to meet, but setting small improvements is kind of what WIC is all about, and to get them to use those staple foods that they're getting in the program through the food instrument voucher, which we'll talk about in a little bit. Throughout the pregnancy, the pregnant mom comes in just about once a trimester for follow-up visits and education, and again, follow up on the goal plan, and whether or not they've reached their goal, would like to establish a new goal, or talk about barriers to achieving the previous goal. As I mentioned, once the baby's born, we see mom and baby at about 6 weeks postpartum, and then we start following mom and baby about every 3 months during that first year of life. So 6 weeks, 4 months, 6 months, 9 months, and then a year. So we're touching base with them and doing a lot of other kind of wraparound services during that first year of life, which I'll talk about in a little bit. The food vouchers are actually still paper vouchers here in Illinois. We're working towards getting an electronic benefit transfer system like food stamps and cash assistance. That will probably happen in the next 2 to 3 years. But right now they are paper checks that look like kind of payroll checks that actually print the foods on each check with the maximum dollar amount that can be redeemed at the store. The vendor services piece of WIC is run by the state and separate from the local health department, so all the grocery stores in town that accept the WIC vouchers are enrolled with the state. They have to meet certain criteria regarding how many of the WIC foods they actually carry to be able to be enrolled, and WIC is a multi-million-dollar benefit here in our county. Our small county of Champaign County gets about $2 million in food benefits for that population of 4,500 clients every year. So it's a motivation for grocery stores to participate, because WIC is big money. Anytime WIC makes a food package change and what types of sizes or foods are available, the actual food industry responds and makes those foods pretty quickly, because it's something that they want to stay a part of. The type of foods that are received during the WIC program are really staple type foods. As I mentioned, it was created back in the 70s when there was some deficiencies with protein, dairy sources, iron. So it's a base staple food package of things like milk, cheese, cereal, eggs, beans, and in the last 5 or so years, the Congress has made some changes to the food package where recipients now get a fruit and vegetable voucher that doesn't define the type of fruits and vegetables. They can get canned, they can get fresh, but they'll get a certain dollar amount every month in their food package to try to improve access to nutrient-dense fruits and vegetables. There is an option for juice and peanut butter and some other flexibility within the food packages, but they're pretty standard and pretty formulaic when it comes to what's offered. Postpartum women get the same type of food. They can receive food up to 6 months after they give birth, or up to a year if they're breastfeeding. WIC is a breastfeeding first program, so we promote breastfeeding and support breastfeeding during the first year of life through trained lactation counselors and internet. We have one international board certified lactation counselor, so they are the experts when it comes to breastfeeding and the barriers and the challenges of that. Breastfeeding has all sorts of benefits that I won't get into today, but that is by far the best choice of feeding an infant. Kids get foods as well. Once the child is born, we start providing foods to each eligible child, as well as I mentioned, any pregnant mom or postpartum mom in the house. So you can get upwards of, outside of the formula that we do provide as well, you can get upwards of $75 to $100 worth of food per month per recipient. So it's not a drop in the bucket. If anybody has to buy milk or anything on a regular basis, that can become pricey and can become a barrier to the lower socioeconomic status folks to actually purchase themselves. So again, this is defined foods that, not like food stamps where they can go get whatever they want. They would need to go get low-fat milk, for their choice of milk in the program. Anybody that wants to register for the program, they have to show their income if they don't have a medical card or one of the other adjunct eligibility programs like TANF or cash assistance. They need to bring in proof of residency to show that they actually live in the county, and obviously proof that the child is under 5, or that they're actually, once they're born, we get a hospital bracelet or some other proof of birth through our vital records. We can actually get a birth certificate. So we just need to know that they live in the county, need to know that they're present in the county, living somewhere in the county, and anybody that meets the income guidelines or those adjunct eligibility can get service. So within the WIC program, again, the education is the big piece. It's the reason that it's successful. Meeting clients where they're at is the new way that WIC is kind of changing with the research. All of WIC is evidence-based, so it's based on current research. That's why food packages have changed a couple of times during the 40 years of the program. Our counseling style has changed because I didn't mention it, but it's a USDA housed program. So it's actually coming out of the United States Department of Agriculture in the Food Appropriations Bill. So they're always looking at the research and what needs to be tweaked or changed with the program. And then the states have a little bit of purview on how to implement that. So thanks for watching my webinar.